For your medical school interviews, you need to know about the hot topic of public health. So in this video, I'm going to be summarizing the key points that you can convert your interview invite into an offer. I'm Loveleen, a first year medical student at King's, and don't forget to check out my interview document using the link in the comments, as that contains all of the medicine interview content that you need to know. In the UK, actually the leading cause of death is non-communicable diseases rather than infectious diseases. So this means that a lot of lifestyle factors often have an impact on the chances of someone developing that non-communicable disease. As a result, the government has tried to include different interventions to try to reduce the risk of someone developing these conditions. One of these includes alcohol pricing and having a minimum unit price. This has been introduced in both Scotland and Wales. And another thing that has been introduced across the UK is actually the use of the sugar tax, which means that if a certain amount of sugar is in a drink or in food, that food is going to be taxed at a higher rate. This actually led to companies trying to reformulate their drinks to reduce the amount of sugar in them. And then another thing that often has been considered controversial but considered is something called the fat tax, which has not been introduced yet, but is being potentially considered as something to be introduced. So if certain foods contain a certain amount of fat, again, there would be a tax charged upon that. As part of your medical school interviews, you need to be able to talk about these and understand what these different interventions are possibly already been introduced or being considered to be. Now, one thing that you need to bear in mind is that yes, following on from COVID, there was an increase in obesity rates, but there's also an important element of ethics here. By imposing these different taxes, does this mean that we're imposing against people's autonomy or almost dictating what people can buy? That is something that you do need to consider when talking about the introduction of these different interventions. However, it's also important to bear in mind that we also want to reduce the risk of communicable diseases. So balancing these two arguments in your medical school interviews will help to show that you have a strong understanding into this topic.